Hello students, so we'll be starting with the part 2 of the Path and Lab, that is the 80,000 series. So let us begin with the part 2 presentation. So let us first understand what is the clinical pathology and what is the surgical pathology. Clinical pathology, which is also known as a lab medicine, it mainly focuses on diagnosing the diseases through the lab analysis of the bodily fluid such as blood, urine, and tissue extract. It encompasses the discipline like clinical chemistry, hematology, microbiology, immunopathology, transfusion medicine, and lab informatics. Pathologists oversees the test accuracy and may interpret the result. Now let us come to the surgical pathology. It is a major branch of the pathology which involves examining the tissue removed during the surgery or the biopsy at both the gross and microscopic level. Technique can include histology, immunohistochemistry, and molecular testing. This area provides definitive diagnosis, especially for tumor, determines the surgical margin, aids in cancer staging and subtype identification, and it helps guide treatment plan. So the clinical pathology is nothing but the analysis of the fluid and a lab test, while the surgical pathology is nothing but the analysis of the tissue structure and the morphology. Now, in the clinical pathology, the CPT codes are for the consultation service, which starts from 80503 to 506. These are interpreted and billed based on the medical judgment for abnormal test result with documentation required. No face-to-face contact is necessary unless substituted with an evaluation and management code. But ENM cannot be billed in addition to this consultation code on the same date. What are these codes? This code describes the consultation service. It has to be initiated by another physician or qualified healthcare professional, required medical decision making, and does not require face-to-face patient interaction. So I'm again, you need to ponder on these points again. So if you see, these are the code for the clinical pathology, and they have the, the language like the, what is the kind of decision making and the time required. So let us take example, a nephrologist consult a pathologist about a patient with a atypical protein electrophoresis result. The pathologist review the electrophoresis pattern, correlate with the immunofixation result, check the past trend, and rules out the multiple myeloma. After 25 minutes of the review and the documentation, the pathologist provide a report. So how will you build this service? So after going through all this data and the time, we can code this as 80505 for the high complexity consultation. We take into the time as well as the medical decision making into consideration. So let us take one example. Dr. Mondial provided a comprehensive clinical pathology consultation at the request of Dr. Adam. This request was regarding the patient with a various infection, drug allergies, and skin rash and Down syndrome. The patient is in the hospital intensive care unit being treated with a intravenous antibiotic. Dr. Mondial did not see the patient but reviewed the patient history, complex medical record, and provided a written report back to Dr. Adam regarding his findings and recommendation for further treatment. How would Dr. Mondial report his service? So, and we have this particular option. So, tell me what is the answer. Now, in this case, one must understand that there are two doctors and we have to code for the Dr. Mondial, who's a clinical pathologist. So yes, A is the correct answer. I mean, that's the only clinical pathology code we have, and we need to check here the medical decision making, and this is of the high complexity. So we will go with the answer A. So for the clinical pathology, these are the branches like urine analysis, chemistry, hematology, immunology, and the coagulation. So we'll be going through all of them. So the first is urine analysis, where we analyze the urine and give the result. Now in this we have the automated or non-automated with or without microscopy. So one must pay attention how the urine analysis has been carried out. So as far as the urine analysis services are concerned, we have the dipstick or the table region, and then the non-dipstick, which is a manual chemical method. Then we have automation. In that we have automated testing and non-automated, which is mainly a manual. And then we also have the microscopic involvement, which is mainly without microscope or microscope only. So depending upon that, we pick up the codes. So here is the first question. What is the code and any required modifier for a dipstick urine analysis automated without microscopic performed in physician office for a Medicare patient? So the important wording is it is automated without microscopic, it is a dipstick analysis. So go through all the codes and tell me the answer. So yes, 81003 is the right answer because it is automated and it is without microscopy, and QW is the right modifier for that. The next question is a 58-year-old male patient with abdominal pain and episode of bright red blood in his stool report to his physician office for a checkup. His physician perform a digital rectal exam and test for occult blood. Dr. Smith document this blood occult test was done for a purpose other than the colorectal cancer screening. How would you report the occult blood test? So what has been done? The occult blood test, and we have the codes here. We need to pick up the right code. So if you look at the codes are all of them are blood code for the blood occult. But what differentiate the code is one is for the colorectal neoplasm screening, and this is other than, and in our patient case it is other than the colorectal screening. So 82272 is the right code. Next question is the Kathy has had intermittent abdominal pain, occasional diarrhea, stool frequency and bloating. Her symptoms have worsened over the past 2 months. Her physician ordered the fecal calprotectin test to check for the Crohn's disease. How should you report the lab test? Now in this case, they have given the special test, that is a calprotectin test, and we need to find out the right code. So if you have seen on this code, we have a special test for the calprotectin fecal test, and that's what exactly done for the patient. So depending upon that, we will pick up the code. Yes, C is the right answer. So the next important topic in our list is a molecular pathology. So let's understand that. So let us understand what is molecular pathology. It is an evolving discipline within the pathology which focused on diagnosing the disease through the examination of the molecules such as DNA, RNA and proteins within organs, tissue or bodily fluid. It's aiming for more precise diagnosis by tissue-based evaluation and molecular testing. The codes in this section of the CPT are divided into 5 groups. One is genomic sequencing procedure, which are called as a GSP. Then the multi-analyte with algorithmic analysis, which is called as a MA. And then the PLA, that is a proprietary lab analysis. And then we have tier 1 and tier 2. Now first let us understand what is tier 1 codes are. The tier 1, these are generally high volume commonly performed tests, and each code refers to a particular analyte. So if you see the tests, they are for specific gene or HLA locus. We do the test for cystic fibrosis, which is called as a CFTR test, or the lung cancer, which is EGFR. Then we have a CRAS, that is colorectal cancer, and more famous or very commonly done test is a BRCA1 and BRCA2, which is mainly done for the breast or the ovarian cancer. So you will see that most of these tests are commonly performed, and so the every test, for example, if you see this particular test, it says it is a CFTR gene analysis common variant. So this is all about tier 1. Now let us come to the tier 2 test. The tier 2 molecular pathology procedure codes, they fall in this range, and these are used to report the procedure which are not listed in tier 1 molecular pathology codes. This code represents the rare disease and molecular pathology procedure that are performed in lower volume than tier 1. Now, if you see the tier 2 tests, they are organized into level, and these level they are based on the resources used, complexity, and interpretive work. So, for example, 81400, it is a molecular pathology procedure, but here they have mentioned the level 1. So it is the simplest and least resource intensive test. Well, if you look at the code 81408, it talks molecular pathology procedure level 9 and most complex. So there are levels as far as the tier 2 tests are concerned. So here this is a snapshot of all the 5 groups that we do it in the molecular molecular pathology. The tier 1 molecular pathology codes, which are standardized tests for commonly analyzed gene. Tier 2 are less common genetic marker and panel based tests. Some of them are panel based, so please pay attention whether the panel has been included or no. Then these are the proprietary lab analyte, that is a PLA codes, which are lab specific genetic tests used by the individual provider, and genomic sequencing procedure, which are GSP codes. These are assigned to next generation sequencing and panel based genomic testing. So the next topic is chemistry. Now, what are the guidelines? First of all, you may report the same analyte multiple times if specimens are taken from different sources like serum and urine, or from the same sources at a different time like the serial glucose test. Each is considered separately reportable. This is very important. Then the quantitative by default. Unless stated otherwise, all analyte tests are considered quantitative by default. And the third is panel versus individual code. For organ or disease panel, we have the panel code, and do not unbundle the panel unless clinically justified. Because most of the chemistry tests, like whenever it is not the part of the panel code, we come here to pick up that individual code. So remember that if it is a part of the panel, we do not write this chemistry code. So let us take one more question. Patient that is borderline diabetic has been sent to lab to have an oral glucose tolerance test. Patient drank the glucose and 5 blood specimens were taken every 30 to 60 minutes up to 3 hours to determine how quickly the glucose is cleared from the blood. What code is reported for all these tests? Now again, there are 5 glucose tolerance tests that has been done. So we will go through all the codes and will pick up the correct code. So yes, D is the correct answer, because how many specimen we have collected? 5 blood specimen. And if you look at the code 82951, it talks about the glucose tolerance test, but 3 specimen. So it includes 3 and we have done 5. And 82952, it talks about each additional specimen beyond the 3 included in 82951. And since it talks about the word each, we will have to multiply it by 2. So let us take the next question. A patient with a severe asthma exacerbation has been admitted. The admitting physician ordered a blood gas for oxygen saturation only. The admitting physician performed the atrial puncture, drawing the blood for blood gas reading on oxygen saturation only. The physician draws it again in an hour to measure how much oxygen the blood is carrying and select the code for reporting the services and look at the options. Now when we look at the option, we realize that they have used a different modifier. So that modifier will help us eliminate the wrong option, and then we can zero down the correct answer. So if we look at the modifier 90 is a reference outside lab. Modifier 51 is multiple procedure, while modifier 91 is repeat clinical diagnostic lab test. And if you look at the question, what they have done is The physician draws it again in an hour to measure how much oxygen the blood is carrying. So this is a repeat clinical diagnostic test, and it is not it is done in order to check the oxygen level at a different hour, and that's why B is the correct answer. Next topic is hematology and coagulation. Here the codes are for the blood drawing tools, blood count, which could be manual and automated, and pay attention to the detail of what work is done. So now let us look at the hematology and coagulation. The procedures are divided based on the type and the method of the analysis performed. Hematology codes are focuses on cellular blood elements such as a complete blood count, hemoglobin count, hematocrit, and the manual differentiation. Coagulation codes are dedicated to the functional analysis of the blood clotting system, which include the prothrombin time, partial thromboplastin time, um, and platelet function studies. So common hematology coagulations code are, if you are doing CBC without differentiation, we have a code 85027. But if it is CBC with automated differentiation, we have the code 85025. So kindly read the fine print whether you are doing the CBC with differentiation, without differentiation, and if it is with differentiation, whether it is automated or non-automated. So the code language is that specific. So let us take the question. Patient with a deep vein thrombosis require a heparin to maintain the therapeutic anticoagulation level. He has a regular PTT is drawn to monitor his level of anticoagulation. What CPT code is reported? So we need to find out partial thromboplastin time, and we have this code. So kindly go through each and every code and pick up the correct answer. So yes, option A is the correct answer. Now let us take one more question. A 35-year-old type 2 diabetic patient is feeling weak. The physician performs a stat glucose test in which a finger stick is done, placing a drop of blood on a regent strip. The test indicates the patient is hypoglycemic. The physician gives the patient some glucose supplement and perform another stat glucose test using the same lab test as before 30 minutes later. The second test shows the glucose level returned to normal. How are the lab tests reported? So what happened here is they have repeated the same lab test prior to the glucose administration and after the glucose administration because he was hypoglycemic. So go through all the codes and tell me the answer. So if you look at the code, you will see that every code is very specific. In this case, we carried out the region strip. So 82948 is the correct code and 91 is the correct modifier because we have repeated this test, clinical diagnostic lab test, and that's why C is the correct answer. So the next topic is immunology, where we look for the various antibodies and antigens for the various diseases. So if you see the CPT code range, it falls within the immunology subsection of the pathology. And in this case, the CPT code describes in vitro immunological procedures to detect the antigen antibodies for the infectious diseases, autoimmune disorders, transplant compatibility, and tumor marker. Each CPT code usually represents one analyte or antibody antigen. If multiple antibodies are tested, bill each one individually unless we have the panel code that specify all the tests. So let us take one example to test this. Larry had a venipuncture during his annual physical examination. The blood sample was used for the following antibody test: West Nile IgM, Shigella, mumps, and total hepatitis B. How should you report this test? And we have these options. Kindly go through all the options and tell me the answer. So yes, option C is the correct answer, and I have told you that if there are various antibodies, we code for each antibodies unless there is a panel code which describes all the antibodies. So here C will be the correct answer. Patient will be undergoing a transplant and needs a HLA tissue typing with DRDQ multiple antigen and lymphocyte mixed culture. How will these services be coded? So we need to code for the HLA tissue typing and multiple antigen and lymphocyte mixed culture. So go through all the codes and tell me the answer. So yes, B is the correct answer because this is the DRDQ multiple antigen. But remember, though this is the written in a capital letter, this is the indented code. So I'll be reading HLA typing DRDQ multiple antigen because that's what happened. And then we also had a lymphocyte culture, mixed lymphocyte culture, which is called as the MLC. And for that, we will take the 86821. So this is the right answer. So the next topic is transfusion medicine. Here we mainly include the blood transfusion. The tests are performed on the blood or blood product. We screen the blood for antigen, antibody, blood typing. Parenthetical notes are important, especially when counting the units. So these are the important points to be considered. So, the transfusion medicine code describe the procedure and lab testing related to blood typing, cross-matching, antibody detection, and blood product handling and transfusion support. These code cover the lab-based testing procedure related to transfusion. These are the pre-transfusion compatibility tests. This is very important, not the actual transfusion. So prior to transfusion, whatever the test we do it on the blood, that we cover in this particular section. But the actual transfusion of the blood, that we cover in the medicine section. So this is my last slide from this particular part 2 presentation, and then we will have part 3 presentation.